Thanks for having me on this World Obesity Day. My name's Kalinda Griffiths. I'm a Yawuru woman and an epidemiologist at the Centre for Big Data Research and Health at the University of New South Wales. I'm calling in from the unceded lands of the Larrakia people in Darwin, and I would like to pay my respects to all elders, those of the past, the present and the future, as well as acknowledge other Aboriginal and Torres Strait Islander people present or online today. Today, I wanted to talk to you about data, and I wanted to have a chat about population level data used for the purposes of measuring inequities impacting Aboriginal and Torres Strait Islander people in health. We all know about the health gap, but I wanted to get you all thinking about the need for appropriate and quality data to better address health inequities, including obesity and its resulting conditions. So we're in the data era, and data is important for understanding distributions of health and well-being within the nation, whether it's mapping healthcare services, evaluating frameworks and strategies, some of which we've heard about today, or for monitoring disease incidence and outcomes. Data plays a massive role in our understanding of health in society. But the picture is expansive, it's dynamic. Data is growing exponentially every day. And while data has this incredible potential, there are a range of considerations and I guess gaps regarding data and data use when working within the Indigenous context. So a review that we published in 2019 that arose from previous work regarding the visibility of Indigenous peoples in official statistics around the globe found that there were three primary considerations when it comes to using data, Indigenous data in Australia. And this included who is counted. And this requires considerations regarding the definitions of Indigenous peoples and the operationalisation of those definitions, as well as the propensity to identify, so the willingness to identify. Secondly, how many people are counted. And this includes issues of the completeness of the coverage, of the accuracy in the enumeration of the data, as well as the methods used by agencies and research groups to address issues of overall under counts as well. And thirdly, what is counted and measured. So this involves development of indicators and measures that encompass Indigenous people's states of events, values and understanding. So what matters to Indigenous peoples? So most official data collected by governments on Indigenous peoples is developed within a colonial and racialised context. And what this has resulted in is what we call coloniser sanctioned forms of recognition. What do I mean by this? Well, while the recognition of identity, so who we are, can be achieved by Indigenous peoples for Indigenous peoples, we need to be cognizant that the recognition of indigeneity within the data, so whether or not people are identified and how they're identified, has historically only been granted by governments. So as an example, the Australian government officially counted Aboriginal and Torres Strait Islander people from 1901 to 1967 for the sole purpose of excluding us from the national population count. In 1967, Australia had a referendum, which resulted in the change to Section 127 that saw the inclusion of Aboriginal and Torres Strait Islander people in the census. This inclusion only arose from the nation's moral imperative to include and count Aboriginal and Torres Strait Islander people via a democratic vote. Indigenous people have the right to recognition, the right to be counted and to be visible in health and wellbeing estimates. In fact, individual and collective rights to citizenship in Australia can only be met with accurate identification and accurate counts in the data collected about Aboriginal and Torres Strait Islander people. When it comes to data supporting equity in health, there's a requirement for proper population estimates and accurate population estimates and information that can provide us with details about the current state of events. There is also a requirement to ensure that people are identified within systems that support them. And I guess without which this can see people not receiving appropriate or necessary care and support that they need. There is a saying that goes, what gets measured gets done. The issues in Aboriginal and Torres Strait Islander data have now been known for over 45 years in Australia. There have been improvements, but it's been marginal, with research and reporting still having major issues with the quality of the data used. And this is because the considerations and the issues in this space is really very complex. Anything embedded within colonial constructs with existing unequal power dynamics always is. And we see it in the lagging improvements in health outcomes for Aboriginal and Torres Strait Islander people. Some of our work in Australia is in developing an evidence base for Indigenous data governance to promote sovereignty in practice and improve data quality. And this will support the measurement of health and wellbeing overall, I guess. Those things that are seen are much harder to ignore. We have the capacity to improve and better support Aboriginal and Torres Strait Islander sovereignty and data, and to do more to bridge the health disparity gap between Indigenous and non-Indigenous people in this country. I wish you all a happy and productive World Obesity Day, and I hope that data will be in your considerations into the future as well.